What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. I'm your regular host, Tony Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Hello and welcome to Exposé, your Monday tonic. I'm your regular host, Tony Akinyemi, and this has been brought to you by the Shepherd's Flock International Church. In the last couple of episodes, we've been dealing with medical systems, and I hope you've been enjoying it. We have laid a foundation. We have tried to explain the different medical systems there are out there. We have talked about allopathy, which is the conventional medical paradigm, what many people refer to as orthodox medicine. We have talked about naturopathy, we've talked about osteopathy, we've talked about homeopathy, we've talked about chiropractic medicine. We've looked at Ayurvedic medicine, we've looked at Oriental medicine, we've talked about even African traditional medicine. Okay, and after laying that foundation, I promised that I'll be bringing practitioners in all of these systems, one after the other. And we've been honored to have world-class practitioners on this platform sharing their thoughts, their experiences, their modalities with us in the various paradigms, medical systems. We had someone who had worked with the FDA in America for years and who has worked with one of the 3 top leading pharmaceutical companies in the world, who did toxicological studies on one of the major malaria pharmaceutical drugs in the world, and who now practices integrative and functional medicine right here in Nigeria. We had him on this platform. We've had a PhD holder in agricultural science and taxonomy and herbal remedies. We've had a homeopathic doctor who is also a neurologist, consultant neurologist. We've had someone who did public health and community health and is now doing herbal and alternative medicine. And we've shared their stories, their practice, their experiences, and their impact. And today we are honored to have another person in one of the medical systems. Of course, like I normally do, I let them introduce themselves. It's better to hear it from the human being's mouth, not the horse's mouth. Okay, and today we have in the house someone who trained in different fields, and now there's a convergence. And those backgrounds are helping her to bring wellness and support to clients, to patients, to people who need her experience and expertise. And she's no other than Dr. Ololade Akinrinola. And I'm happy that she was able to make it today. Doc, you're welcome.
Thank you, sir.
To Exposé.
Thank you.
It's good to have you here. Thank you for obliging us this interview.
Yes, sir.
Our viewers would like to meet you. They want to know, who is Dr. Ololade? Where are you coming from? Where have you been? What trainings have you had? What exposure? What experience? What skills?
Hello, everyone. Thank you for having me, sir. My name is Dr. Ololade Akinrinola. I actually did my first degree. I obtained my first degree in physiotherapy from Obafemi Awolowo University, Ile-Ife.
OAU, Oba Awolowo University.
Yeah, that is Reverend's alma mater too.
I was honored to attend that world-class university.
Yeah, that's right. That's right. And to further improve myself and deepen my knowledge, I attended several professional courses, both locally and abroad. I'm a certified lymphedema therapist in the US. I am a health, safety, and environment practitioner in the UK. And I obtained a Doctor of Osteopathy qualification from Canada. Also, I have a qualification in natural nutrition from Canada too. I discovered that knowledge it's a rounded thing that can help to have effective practice and excellent clinical outcome. So the knowledge I've gained in these areas helped me, let me say it has played, or it plays an important role and help give patients a multiple or a modified, diversified treatment approach. A diversified treatment to their treatment plan. So it has really helped me in actually narrowing down patients' condition, and it has given me, I would say, a little bit of edge or to actually approach in different ways when I'm handling my clients.
Thank you very much. You've mentioned 4 different countries.
Yes, sir.
That you have passed through in your trainings and your certifications.
That's true.
Started from Great Nigeria.
Yes.
And Great Ife, Obafemi Awolowo University, where you studied physiotherapy. Physiotherapy. Now, tell us in 30 seconds, what is physiotherapy all about, in case there's one person there who doesn't know?
Okay, physical therapist actually can be called physical therapist. Actually means that using physical means and agents and modalities in treating patients, in rehabilitating conditions, could be musculoskeletal, tendon, ligaments, and injuries. So basically, the modality used could be heat and cold therapy. It could be electromagnetic field therapy like ultrasound, shortwave, things like that is used, and it's more manual because you use your hand to diagnose, to treat, and a bit physical. So you need to have a bit of strength to actually do a lot of things in physiotherapy. But the main thing is that it's more about rehabilitation of the body to near normal or probably even to normal.
Good. And physiotherapists normally work in even conventional hospitals?
Oh, sure, they do.
Primarily?
Yeah.
Right, okay. Now, after that, you also mentioned the US, you mentioned the UK, you mentioned Canada. Now, I got what you studied in Canada and the US. The UK?
Yeah, okay.
What did you study in the UK?
Actually, I did a certification in health and safety. So I'm a certified health and safety officer too.
What does that entail? Health and safety certification?
And safety, yes. It's about implementing safety and eliminating risk in the workplace. Actually, that's what it's all about.
Okay, okay. So if a corporate organization, let's say they have 120 staff and they want you to do some training or formulate some policies for them for the safety of their staff and the environment, the workplace environment. Those are the kind of things that you do in that.
Right.
And then in the US, you certified in the management of lymphedema.
Yeah.
I know some of our viewers want to know what exactly lymphedema is. I've seen quite a number of cancer patients who have had their lymph nodes removed.
That's true.
And so they have their lymphatic fluid draining into their arm and the thing swells up and all of that. So give us more insights into what lymphedema is all about and your approach to addressing it for those who have such issues. To be simple, in a simple term, lymphedema. Lymph nodes and the edema, we can say swelling. So we can say the swelling of lymph nodes. So lymphedema is a condition that actually is caused by swelling in any part of the area due to a buildup of lymph fluids. So, and lymphedema can be primary or secondary. There are 2 types of lymphedema. It could be primary or secondary. The primary one is a congenital one. Maybe somebody was born without lymph nodes, missing lymph nodes, or probably impaired. Okay, so that one is congenital. Okay, in the case of the secondary one, that can be caused by surgery. The case you mentioned, the picture of breast cancer. Many of my breast cancer patients that have done mastectomy, a radical one, maybe during the surgery, lymph nodes has been removed, or it has been tampered with, sometimes damaged. So after the surgery, of course, that's the major complication they suffer through. So, and also radiation therapy
can actually destroy lymph nodes too. And it causes a buildup of fluid in the part of the body. And to talk briefly about that, it's lymphedema approach. It's basically a particular way we approach it. They call it CDT. That is a complex decongestive therapy. And actually it focuses it has a multiple methods in actually, the therapy actually has a multiple method of alleviating fluid retention in the body.
Okay.
So we do, one of the methods, it's wrapping and compression. That one is basically bandaging and using special
socks or kind of
compression
socks or garments, you call it. Okay.
Yeah.
We laymen call it socks.
Socks. For the clients. And another one we use is, they call that manual lymphatic drainage. This is special manipulation.
Kind of massage therapy?
Something like that, but a bit deeper than massage, because this is a manipulative, because you have to be very good in anatomy. It's not just massaging. You want to drain something, so you don't just massage and clog the place. So it's a decongestive process. So it's more of manipulation of a soft tissue in the body in a particular area, so that it can aid the lymphatic drainage to flow through. And we do skincare regime, because many people with lymphedema problem, they have, of course, the skin will not have its nutrients. Right. So over time, when the fluid is it's chronic, before you know it, it could actually solidify. And over time, the skin can break up. And in that, we have to prevent infection, treat wounds and all that. So it's a lot of things together.
That's a lot. Yes. So if someone has either primary or secondary lymphedema, you are the kind of person they should be seeking out.
I think so. That's the only way, because even apart from that, generally, before any major treatments for any natural medicine practitioner, we talk about detoxification. We talk about removal of toxins from the body. One of the major things I do is we open the lymph nodes so that the fluids can flush through away from the system, just to unclog them, so that any treatment you are doing, any complementary therapy, the treatment will be effective.
Okay, yes. Great. I've seen quite a number of people with lymphedema. I think I even referred one young lady to you recently. I don't know if they got across to you.
Not gotten across to me.
That one I think is primary, because it's a young lady.
I've seen a guy that you referred to me. That was last year.
Somebody just about 2 weeks ago. They've not contacted you yet. Okay, right. So that's one area of specialty that I don't think is very common in this climb.
That's true. The truth is that I don't think I've not met another lymphedema therapist in Nigeria.
Yeah, so you probably are the only one.
Maybe I'm the only one. Maybe I'm not
Certified
sure. Certified one. Maybe I'm the only one. I'm not sure.
So I mean, you should be hot cake.
Yes, people come from all over the place with their drainage, especially when they have these issues, and I have a lot of cancer patients, especially even after surgery, kidney problems, because it affects other parts. It's basically fluid retention in the body, and when it's like that, of course, the person is full of toxins, and immune system is actually compromised, because lymphatic drainage, lymphatic system is also called immune system. So when they are interrupted like that, the immune system is compromised.
Okay. So we've dealt with Nigeria. You studied physiotherapy.
That's right.
In the UK, health and safety.
Yes, sir.
In the US, you got certified as a lymphedema therapist. And then we go to Canada. You mentioned 2 things in Canada.
Yes.
One is osteopathic medicine, and the other one has to do with nutrition.
Yes.
Yeah. Can you tell us what those are about?
DO, we call that DO.
Doctors with DO in front of their names. Doctor of Osteopathy.
Doctor of Osteopathy.
Right.
So osteopathic medicine, it's actually a medicine that has to do with the whole person. The approach is all. It's more holistic compared to the physical medicine. And it's actually, the major idea there is that all the body systems are interrelated, and that many diseases come from musculoskeletal disorder. that is the theory behind osteopathy, that many diseases actually can be related to musculoskeletal disorder. And they are primary caregiver too. They prescribe drugs. In fact, they do surgery, minor ones, and they do more of osteopathic movements, and that is manipulative movements.
Oh, okay, good. Now, I want to clarify something before we go on break, and then when we come back, we'll now be delving into osteopathy proper. Okay. In your physiotherapy, there are other physical therapists that are a little bit close to physiotherapy. I want you to clarify things for us. For example, there are chiropractic doctors who also use their hands to do some manipulation.
That's true.
I want you to touch on what are the differences between a physiotherapist, a chiropractic doctor on the one hand. I know that osteopaths also do manipulation.
A little bit apart from
So what are the differences among all these different ones? Then there's another one that is called DPT, Doctor of Physical Therapy.
Okay.
Actually, in the US, I know there are people who specialize, who train and graduate as doctors of physical therapists. And
which I'm doing. I'm running the course right now.
Right now?
Yeah. Great.
So there's something I was going to ask about BPPV. I'm sure you're familiar with that. That they call it benign paroxysmal positional vertigo, BPPV, with crystals in the ears that get dislodged and give people some imbalanced feelings, and they have this. Sometimes it leads to vertigo. Some people call it vertigo.
Yeah, anyway, that's
whatever.
America is vertigo.
Vertigo, and then other places call it vertigo. Yeah, where the ground is spinning.
Yeah,
because of crystals that are dislodged, and then they have all kinds of different practices they do. Okay. Yeah, so that's the one you are specializing in. So that's going to be number 5.
Okay, I have a lot of questions to answer.
Yeah. Okay. All right. So just because we need to go on break now. In a nutshell, let's see.
Okay, like physiotherapy, chiropractor, and osteopathy. The part of physiotherapy mainly we use hands. And like I said earlier, it's totally physical. We use physical agents and modality in treating. And assessment, we have to be very good in anatomy to assess the musculoskeletal disorder. We look at the posture and other things for physiotherapy. And of course, we use our hands on. It's more manual. So the aspect of the chiropractor, now, they use hands too. It's totally hands-on too for that too. But in case of osteopathy, because we are a bit, we are more into holistic. The other part of it is osteopathic manipulation. So we use hands, despite the fact we use hands. We're still a primary caregiver. We still have to prescribe drug if it is necessary. We prescribe drugs, but because that's another part of osteopathy actually. So the other part of osteopathy is hands-on that we use on hands-on. Then you said something about. Another question about vertigo.
DPT.
DPT. Okay. In the case of that,
Doctor of Physical
Therapy. Okay, the DPT. Actually, in Nigeria, we don't have that. We actually finished. We have only BSc. Like where I finished from OAU, you have BMR. That is Bachelor in Medical Rehabilitation, because the department has two courses, physiotherapy and occupational therapy. Okay. So you finish with Bachelor of Medical Rehabilitation, that you have to specialize physiotherapy. Okay. So in Nigeria presently, there's nothing like DPT because of, I wouldn't know, maybe curriculum and all that. We all graduate with BSc. So if you have to, furthermore, it's only abroad that they are doing DPT. That is Doctor of Physical Therapy. And that makes you specialize in a particular area when you finish, right? Because a very, a very high, let me say, high level of physiotherapy, deeper than the regular BSc. Okay. It's like you are studying PhD, quote unquote. Okay. When you're doing the DPT. So DPT, basically, it's not done in Nigeria. We have not yet recognized it in Nigeria University. I don't know why. But right now, it's only done, even in the US, I think in the next 2 years, they're going to scrap BSc physiotherapy. So everybody moves into DPT. Moving. So some people are doing, like me, I'm doing transitional DPT program because of my background and whatever I've gotten. So that's that. And for the vertigo, in fact, I have several patients with vertigo, and a lot of things can cause that. Even stroke can be a cause of vertigo over the time, age, insomnia, a lot of things can cause that. So basically, it affects the balance. There's the high spinning. Yeah. So in osteopathy, that's why another part in osteopathy, apart from giving medication, they call it cranial sacral therapy.
Right.
We try to stabilize the spinal fluid from the brain because it's coming from the CNS. So we try to stabilize that because, quote unquote, there's no cure for that. So the person rather stays on medication, avoid some particular movement, or don't trigger whatever that can cause it.
Okay.
So the do's and don'ts, preventions is so much, but there is no cure for that. So basically, we approach it with a lot of things, nutritionally.
Right.
Not manipulation, but this therapy I talked about cranial therapy, we approach with that, and we've seen a tremendous result of that. Okay.
Praise God. Thank you very much. We're going to go on the break right now. And when we're back, we'll continue the conversation on osteopathy primarily. And then, of course, you can see that we've been branching into many other areas that were not intended. The way things are going, it looks like Dr. Ololade will come back for part 2 so that we can cover more grounds in all of these things. So don't go away. We'll be back very shortly to continue this conversation.
I believe you've been having a terrific time with me on Exposé with Tony Akinyemi. We have great resources that will bless your life available to you on healthy living and many other life subjects. We have various platforms where you can obtain materials for your blessing. You can obtain some of our work, our books, particularly on Amazon.com. How to Regain and Retain Your Health is a book title that I highly recommend. It's available in digital format, Kindle edition, as well as in printed version. We also have juices and smoothies for healing, health, and pleasure. You can also find these items at another website, familabooks.com, F-A-M-I-L-A books.com. And for those of you who are in Nigeria, you can reach us at the Shepherd Store, 18 Shogunle Street, off Mobolaji Bankantoni Way, behind Etiebes Place, to get our materials. We have over 600 recorded audio CDs, DVDs, VCDs, and MP3s on various subjects. All these things that I teach on Exposé are already available in their complete format. How to reverse hypertension naturally, how to reverse diabetes naturally, how to reverse arthritis naturally, and many other wonderful titles. I encourage you to visit this website, Amazon.com, familabooks.com, or CSS bookstores in Ikeja, Lagos, Nigeria, and you will be blessed reading those materials and sharing them with your friends and family. Thank you once again. God bless you.
Welcome back. This is Exposé, brought to you by the Shepherd's Flock International Church. I'm always happy to be your regular host, and I'm Tony Akinyemi. We have in the house today on set Dr. Ololade Akinrinola, D.O. That's Doctor of Osteopathy. He trained in Nigeria first and foremost as a physiotherapist, earning a bachelor in rehabilitation medicine, and then proceeded to Europe and North America. In the US, she's certified as a therapist in lymphedema management, I believe, and then in the UK in health and safety. Then in Canada, she trained as a doctor of osteopathy, as well as also training in other modalities, nutrition and what have you. Right now, she's currently also doing a transitional training to becoming a doctor of physical therapy. So she's 5 in 1. Wow, that's the number of grace. And she has spoken elaborately on some of the areas where she's particularly proficient, particularly in dealing with or managing lymphedema. That is when the lymph nodes have been either impaired or completely damaged or taken out, either those who were born with such impairments or those who got theirs damaged through surgical intervention, either because they did breast cancer surgery like mastectomy, radical mastectomy, where the breast and the lymph nodes under the armpits were removed, and then they find their hands, kind of getting swollen because of fluid accumulation in that hand, because drainage has been clogged and impaired some way or the other. And then she also does so very well with her hands when it comes to stroke patients and those with vertigo and other issues with balance and what have you. It's an honor to have you once again. We thank you for coming.
Thank you, sir.
Right now, we want to delve into osteopathy proper. And because we always tell people what we need is not more medication, but more education.
That's true.
For the best prescription is knowledge. We say to them, to be uninformed is to be deformed. And to be informed is to be transformed. So when we know what is available, then we have options. We can always access what is needed. We had one of the experts here in one of the previous episodes recently, and he shared a very touching testimony regarding one of their relatives who was sick and couldn't get help locally. She herself being a nurse, she couldn't get help locally, so they were already preparing to kind of take her abroad, for surgical intervention and treatment. And the legendary Dr. Oye, who is very adept in taxonomy. He has a PhD in agricultural science. He also has a doctorate in naturopathy as well. So he went to visit them and then found out that the woman was sick and inquired what was wrong. And they said this and that, and they are getting ready to take her abroad for treatment. And he said, wait a minute. This particular herb can address this matter. And went to their backyard and found that the very herbs that they needed to attend to that problem was in their backyard.
Interesting.
Harvested them and told them how to apply. And that was how the problem was solved. She didn't need to travel anymore.
Interesting.
Sometimes we don't know what is available.
That's true.
And that's why people die, people suffer, people spend money, people travel all over the world. Now, many people don't know that someone like you exists in Nigeria. And that's why they probably will be saving money to go to North America, go to Europe, go to Asia, to be able to get it. My desire is that one of these days, Nigeria will have every single thing available out there. That nobody will have to travel because they couldn't find such therapies or therapists in Nigeria. Everything will be here. And possibly, one of these days under one roof.
That would be great.
In an integrative medical center where all of these modalities will be made available. All right. We've been trying to put a few things together along that line to see how we can make things available to Nigerians, available and affordable. And so we have Dr. Ololade Akinrinola in the house. I want to ask the next question from her regarding osteopathy. What is osteopathy? How is it distinct from allopathy or orthodox medicine? What are the unique selling points of osteopathy?
Thank you, sir. So osteopathy itself, it's holistic.
Right.
It focuses on the cause of the symptoms the patient is experiencing. Unlike the conventional medicine, that the experiencing of the patient, the symptoms they're experiencing, it's what they will use to identify an illness that will let them get to a treatment plan. So in the case of osteopathy, the symptoms is not even what is important, but the root, the underlying cause of the symptoms.
That was exactly what the naturopathic doctor said.
Yes, that's what we do, Right. That's what we focus on.
Right.
And maybe let me give, for example, somebody coming with maybe migraine or headaches that has been there for a long time. And as an osteopath, I'd rather say, how did that happen? Not, even though I can prescribe medication to you, I won't do that immediately. I'd rather look at other things, ask about other body systems to actually detect, to know the cause of the headaches. So you have seen cases of somebody has been constipated for a long time. The person has a sluggish bowel movement. So I think she goes to the bathroom. That's toilet. They call it toilet here, but bathroom over there. If you say bathroom, they know you're going to the loo. So the lady goes to the bathroom, I think, twice in 3 weeks.
Oh my goodness.
It was that bad. You can imagine the toxins clogged in her system, and she's complaining of headache, fatigue, and all that. So I said, oh, the headache is not the issue. It's the constipation.
Yeah.
So we actually, that is it. We actually treated that, make sure she was able to, move her bowel, do some cleansing for her. That is maybe colonic irrigation and all that. And support her with
does
other
osteopathy
things.
also do colonic irrigation?
Oh, sure, they do.
Oh, it's also done in naturopathy?
And homeopathy too.
I see.
It's done that,
Okay.
But, we have different approach. Is that they look alike.
Right.
But they are, they have different science background that to back whatever they are doing.
Okay.
So in that case, we do also visceral manipulation,
right.
And that is a gentle movement of the organs in the system, in the abdomen. So when we do that, sometimes we experience that patient I was telling you about. Totally, the colon, the intestine, they are totally rigid. So it was during the visceral manipulation, a bit of stretching, not painful, but the person will feel the pressure, and after that, boom.
So that improves the peristaltic movement.
Very well.
Right.
Yeah, that is it. The peristaltic movement of the colon was moving, and she was able to go to the bathroom. And after that, of course, headaches go. No more headaches.
So, which means the headache is probably being occasioned by?
Occasioned by, not every
build
time.
Up.
Over time, but now, not at the time it was occasional one. Later, it became a permanent, like a continuous headache that she was having for a long time, because she wouldn't go to the bathroom, and she has been doing this for over 8 months. She wouldn't go to the bathroom, and because
I actually saw a young boy under 10, who had not gone to the toilet for 1 whole month.
Interesting.
1 whole month.
We have cases like that.
They had given him laxatives, purgatives, all kinds of things, but he wouldn't move his bowel.
We have cases of maybe apart from that, there's some congenital cases of neurological conditions.
Okay.
And that's what I was talking about, is cerebrospinal fluid. So
right.
If they are distorted, they say, the brain will not send signal.
Okay.
So no matter what, we give anything. So that's where osteopathy can even help to.
Right.
Where there's a balance from that cerebral fluid.
Okay.
There's a feedback from the brain.
Right.
To other we have the parasympathetic nerves and the sympathetic nerves.
Right.
And when we do that, it balances them.
The two.
And before there's a signal that goes to the body back that,
okay.
Move
kind of feedback.
Well. Yeah, a kind of feedback.
Right.
And it helps in recovery. So.
Good. Now, I'm going to go a step further to ask you to help us itemize what are the philosophies, the principles undergirding osteopathy. In naturopathy, for example, they have 6 basic principles of naturopathy. Same thing with homeopathy. I read up on all of these systems to find out, because I'm going to be interviewing experts.
Yes.
And I need to arm myself to be able to ask intelligent questions.
Yes, sir.
And when the homeopath was here, I asked him, I said, there's the principle of dynamization, the principle of the single remedy, the principle of this and that. And of course, he was wondering, how did you know all of this? Me too, I was bravadoing.
You've gone to read all the stuff.
Yeah, so in osteopathy, what are those principles? In naturopathy, they will say, first, do no harm. That's the first principle of naturopathy. Number 2, they will say the principle of the healing power of nature.
That's true.
And then they will talk about the doctor being a teacher, a coach. Then they will talk about using the principle of prevention, and then the principle of treating the person rather than the symptoms.
Yeah.
So in osteopathy, what are those principles that guide the osteopath in the practice of his trade or her trade? Okay.
Like I said earlier, osteopathic medicine, it's a whole person approach medicine. It's body, mind, medicine. And there's a particular idea. There's one key idea. The idea is that many diseases are related to musculoskeletal disorders.
Okay.
When there's a disorder in the muscles, in the nerves, in the bone, it's likely there's a disease coming up from there.
So which means if there's a distortion in structure,
it
then
can
that will
actually
affect function
of every other part. That's true. Right. And that's one of the major things they believe in. That's one of the principles. And the other principle on that is, they call it sacral, we can call it sacral spinal therapy or sacral spinal therapy movement. So in that therapy, they believe that they call that CSF, that is cerebrospinal fluid,
right.
that if that is distorted, it's not normalized, the body can never heal itself, no matter what you do. And we've seen that.
So how do you normalize that?
Normalize that. Okay.
Or how do you detect that there is abnormality in the first place, imbalance, and then how do you normalize?
That is through diagnosis, okay? Because anybody that comes with a particular presentation, we know that something is disrupting in the functional system.
Okay.
So in most cases, there's a feeling you use by the hand, and just from the below, you put the hand on the head, and to the lower part of the spine, there's a feel. Because your hands have to be trained to actually know the feel.
Okay.
There's a rhythmic movement that's supposed to be going through from the spine, running down to the sacral level.
Okay.
And if you don't get that feeling, you know that there's a distortion in the flow.
Okay.
I've treated people several cases of somebody coming, even with somebody with cancer. We discovered that the cerebral fluid is imbalanced. Okay. So when I'm even treating my cancer patient, I try to balance that first. Okay. It's just to help the body to heal and to put everything in synergy so that when whatever treatment is being done, we can get effect. So that's the major principle of osteopathy is that all these major diseases is related to muscles, nerve, and bone.
I see. So if you can get those things balanced out,
every other thing
will
fall in place, because especially when you're doing complementary treatment now,
right,
it is effective.
Okay.
But if you don't do that, it will not be effective.
Okay. Are there things that a person who wants to do preventive medicine, for example, I'm not sick, I just want to be proactive. If I get to an osteopath and I say, hey, I'm not sick, I just want you to attend to me so I don't fall sick. What will you do for me?
Okay, in that case, what would I do for you is that I would check your system. Actually, we try, because all body systems are related. So we go through diagnosis tests to be sure you're fine. And after checking through the test, basic thing is that to teach you how to prevent diseases, what to eat, positioning, exposure, because people are different. They have different stressor, environmental issues. So we try to identify those things. Even the person is fine, by the time you engage them to know what they're actually going through, you may actually identify their stressor.
Okay.
So with that, we can it's easy for us to say, okay, this is what to do to prevent sickness or diseases.
Okay, because that's one of the things we lack in this part of the world. Most people wait until they have a diagnosable clinical condition before they seek help.
That's true.
But I think the idea of going ahead of time to check and be sure that there are no imbalances, there are no distortions, there are no structural, dysfunctions and whatever in the system, so as to preempt and to prevent whatever might be brewing in the body, or before they reach that level where they become a monster and it becomes more difficult to address
to actually handle.
At that point in time. True. When they are caught in their infancy, it's a lot better to address. Okay, thank you very much. Today again, unfortunately our time is up. Each time we bring these experts here, it's as if there's no time. We should continue to talk and talk and talk. Then we have to sign off here today. Dr. Ololade, I believe, will be back for part 2. And then we're going to be looking at case studies. We look at maybe cancer cases. We look at lymphedema again. We look at any other thing that you want to talk about in osteopathy, in physiotherapy, in your nutritional therapy, and the occupational and different things. Whatever. We want you to look back into your archives, how many people you have worked with without disclosing their identities.
Yes.
Just give us a case study and let us know who are the people who have benefited from your therapy and your approach to wellness. But before you go today, some of our viewers would like to know, how may we contact you? Where is your office, your telephone number, your email address, your website, your WhatsApp number, whichever one you are comfortable to let us know.
Okay.
And the name of your practice, if you have one.
Yes, I do. The name of my practice is Firstville Integrative. Firstville.
Ville.
Yes.
First, First.
Yes.
Firstville
Integrative Wellness Limited.
Right.
Okay.
Firstville Integrative Wellness Limited. Okay.
Okay, so I'll give my phone number.
Okay, go ahead. Email address maybe as well.
Okay, email address too. Okay.
Is that phone number also on WhatsApp? Or you're not a WhatsApp person?
Okay, I will give because
okay, give whatever you're comfortable with.
I try to reduce. Okay, it's better that you send me a text message so that I can respond to you.
Okay.
But I'll give you a phone number. It's 0803 5622 You can reach me on text message on that 0803 5622
and you're based in Kaduna, Abuja, Port Harcourt.
I'm based in Lagos.
Lagos? Why is everybody in Lagos?
Lagos.
Okay, only Dr. John is in Abuja among all those we have interviewed. Every other person appears to be in Lagos. Yeah, that's where it's happening. Yeah. With 20 to 25 million people. That's a very good place to be.
That's true.
Many people needing your services. All right, thank you very much. So that's how to contact Dr. Ololade Akinrinola in case you need to speak with her. And today we're going to sign off here on Exposé. It's been on medical systems. And in the next episode, God willing, we're going to continue this conversation. And Dr. Ololade will be back to continue this discussion on osteopathic medicine, one of the medical systems. Don't forget, what we need is not more medication, but more education. And the best prescription is knowledge, because when you are informed, your life will be transformed. But when you are uninformed, you're actually deformed. Thank you for being our guest this evening, and thank you for choosing to spend your evening with us. If you have not subscribed to our YouTube channel, please go ahead and do so right away. All it takes is for you to click on that subscribe button, and you are in, and then click on the notification bell. And anytime we come on air, your device will notify you that we're on air, so you don't miss another episode when we are live. You can also go to YouTube and check in the search engine, just put Exposé with Tony Akinyemi, and that will bring up all our past episodes. You can watch all our past episodes there. If you're following us on Instagram, same thing. Just follow us on Instagram. You get notified. Or you like us on Facebook, and that also works for, because this is being transmitted simultaneously on those three platforms. I always say, even if you don't like my face, please like me on Facebook. All right? And that will be enough. And you will get information that will continue to be a blessing. Share this also with your friends and colleagues, and they will be glad that you made them aware of what is happening. This is transmitted every Monday, 8 p.m. Nigerian time, and it's been such an opportunity and a blessing for us to be able to serve you at this level. Thank you once again for being with us this evening. Have a very terrific evening and a very wonderful rest of the week. Bye-bye.